right, June is Men's Health Month, so we continue our series. Today we're talking vasectomies with Dr. Mark Hong, a urologist. Stick around, we'll tell you what this watermelon is all about.
This is a disturbing new health trend. More and more millennials are having vasectomies at an earlier age, but there also is growing concern with doctors. So Javi is our vasectomy expert this morning.
No, working perfectly well. Thanks for asking, Scotty. Okay, so younger men apparently are having vasectomies, and then they could perhaps have second thoughts a little farther down the line when they want to start a family. So apparently they're trying to reverse this procedure. And while the procedure can be reversed, the success rate is pretty low. That's where Dr. Mark Hong comes in, a urologist. And you've been seeing this trend kind of spike in recent years. Do we know why?
Well, how do we really know? But, you know, it is true that we have been seeing some younger guys that are in their lower 20s coming in asking for vasectomy. These are actually guys who are single and don't have children yet.
And now, one would think that perhaps they're using it as birth control. That might not be a problem, but talk about the problems when you try to reverse it.
Well, so, you know, first of all, vasectomy is considered a permanent method of sterilization. And, of course, it can be reversed. And actually, I want to make sure that people understand it is absolutely reversible. The actual success rate of reversal is high, but the problem is the longer that you wait after your vasectomy to get a reversal, the actual pregnancy rates will drop over time.
All right, so let's backtrack a little bit and first talk about what is a vasectomy.
Right, so a vasectomy actually, you know, a lot of people know about it, but there's a lot of sort of myths around it as well. The bottom line concept is that you're trying to sterilize the male reproductive tract. And so if we kind of look at the anatomy, right, then the testicles are what make sperm. Those are the active swimmers. And of course, you're cutting the vas, which is the tube that carries the sperm, from the testicle. So essentially what you're trying to do is create a situation where it's
no longer flowing.
That's right. All juice, no seed.
Okay, all right. Great
and
illustration.
In fact, actually, you think about it conceptually, imagine that you've got this and it's creating the seed. Well, you've got the tube, which is the vas, and that carries the sperm. So essentially, conceptually, what you're doing is you're
basically cutting. All right, as a lot of men cringe out there. But it's important to note that you're seeing another trend where more and more women are actually getting vasectomy.
Well, so, of course, I say that tongue-in-cheek because women, of course, don't have a vas.
Yeah, so they don't.
But I think it's kind of important to think that vasectomy and getting a vasectomy is often a couple's decision. And statistically speaking, more women actually choose to get sterilization than men, which is an interesting fact because it actually can be safer and even less expensive for the man to get the vasectomy rather than the woman to get her tubes tied or other sterilization.
The big question anytime you're talking about the nether regions, how much does it hurt?
Yes.
Right?
Well, you know, I think that's the single biggest reason why men fear the vasectomy. And I'll tell you this, you know, there's a lot that's said out there, but at the end of all of that, I think the thought of it is always going to be worse than the actual experience.
Okay, all right. So when you talk about the trend, you're seeing them younger. What is the proper age, or is there a proper age, or it just depends on the scenario and with your significant other?
So this is where it's a truly personal decision. The average age of a guy who gets a vasectomy tends to be in the mid-30s and has a couple kids. Having said that, I think it's just an appropriate discussion to have with your healthcare professional, your urologist, or your family physician. And you also just want to understand what are the risks and what are the benefits and understand what you're getting into, both short-term and long-term. And if you might want to get a reversal in the future, get all the facts about that too.
Again, great information, something we typically don't like to talk about, but the information is key. Dr. Mark Hong, thanks for coming in.
Thank you for having me.
All right, put those scissors away.